Thanks so much for having me. So yeah, I'm Zal Shroff. I'm a senior attorney at the Lawyers Committee for Civil Rights of the San Francisco Bay Area, and I co-lead a racial justice litigation team here. And I just get to locate myself in the conversation at this moment. I think, what I see in my friends and family and the community of people who are paying attention is a profound sense of exhaustion, of helplessness, and of disillusionment in the face of social injustice. And so the questions I try to answer right now in my work is, how do we build power for social justice movements? And how do attorneys facilitate that power building? And how do we win and actually build a sense of forward motion? So as a civil rights litigator focusing on racial justice issues, much of my work in the past has been focused on the carceral setting, seeking relief for the profound harms that our government is visiting on incarcerated folks, with every downstream collateral consequence for the communities that incarcerated people come from. More recently, my litigation has focused on mass incarceration's front door, so draconian probation supervision and control by correctional establishments, pernicious court fines and fees that thrust people into poverty and expose them to criminal enforcement, and the criminalization of homelessness. All of these are major systems of oppression that need to be abolished. And we know they need to be abolished in large part because our researchers and public health experts have shown us all the ways in which these systems harm us and harm our communities. You all have provided that research to us in spades, and yet that research is frustratingly underutilized. Because if we know better, why aren't we doing better? And so the question I have been asking for a while now, and I put to all of you, is how do we operationalize the public health knowledge that's already out there and that you all create? And how can we make sure that that public health research is considered and heeded when policymakers are politically incentivized against the facts and to protect these systems of oppression? So I'll give you a couple examples of how we're thinking through this on my litigation teams at the moment, because we actually start most of our cases now, not with the law, but with the public health research. And in many ways, we view our role as attorneys as a conduit to deliver the message of public health. And I think several of the panelists here have talked about the perils of reformist reforms as opposed to abolitionist reforms. That's an ongoing conversation. In some ways, litigation is in many ways inherently reformist. We are using small doctrinal hooks in an attempt to perform harm reduction on systems that are fundamentally broken. I have no disagreement with that legitimate critique of the project of litigation, but what litigation can do, if used wisely, is build political power. And that's most effective when we adopt the approach of integrated advocacy. So we're bringing a lawsuit at the same time as folks are lobbying the government for change, at the same time as we're moving with grassroots coalitions of organizing actions. And we're all speaking the same message with our different voices and platforms. And when we do that collectively, we can be a force to be reckoned with. So the question is, what are we choosing to uplift when we're doing that integrated advocacy approach? And what's the strategy there? So for our team at the Lawyers Committee right now, we're choosing an intentionally public health lens for our litigation and advocacy efforts. And we're using our platform, our litigation platform, albeit an imperfect one, to elevate public health and community health solutions to various systemic injustices. To tell the story of why abolition is what will save us, even if that's not the relief we can seek through our litigation. So just yesterday, for example, we filed a major case against San Francisco for the widespread criminalization of homelessness, impacting 4,000 people who are forced to sleep on the city's streets because it has failed to build affordable housing and shelter. And then it's policing and criminalizing those communities in unprecedented numbers, thousands of citations and arrests in the last 2 years, and intentional property destruction of people's survival belongings. That's not only fundamentally unconstitutional and immoral, but it could not be more directly related to questions of public health. So I'm going to put in the chat a copy of the complaint we filed yesterday, and you all can take a look at that. But I think you'll note, and it's around page 26 and page 68 are the major treatments of the issue, but we intentionally dive very deeply into public health analyses of what criminalization of homelessness does. How it is proven to exacerbate physical and mental health problems among unhoused people, but also how those costs burden our healthcare system to the tune of millions of dollars in downstream economic and human costs, such that we're doing incredible damage to our collective public health. And then by contrast, we show that the precise cost savings that would arise if cities actually instead invested in affordable housing, as they should be doing. And so when we use that public health research, when we present it to political actors and we give them the roadmap for how to correct their failures, when we talk about public health knowledge in the language of law, we give it power and authority, and we force a conversation. And so I like to think of ourselves as research synthesizers. And so we're designing our cases around the history of racial injustice and also around the detailed public health research that we can compile to show the way forward. And we've done similar work in our fines and fees justice case, where we talk about the profound harms of regressive fines and fees that are a relic of failed mass incarceration policies, and that also directly harm low-income communities and bring us downstream poverty and public health crises. And I'll drop this one into the chat as well. Here, we really fronted, again, the public health and scientific research on the harms of fines and fees. And that resulted in a major win basically before we had to file the case, before we had to even litigate the case, rather, where California relieved over 1 million Californians of $500 million of late court debts. And then finally, I guess I can talk briefly about what is perhaps been the most significant nexus between public health and civil rights litigation in recent years here. And that's the COVID-19 pandemic and the prison release cases that so many of us brought to effectively say to the government, your prisons are your current public health crisis. And by the way, they always have been your public health crisis, and you don't need them anymore. And we're figuring out now how to build on that momentum, even as our governments lose interest in taking those concerns seriously. But there was this moment where we were all uniquely oriented towards public health as a framework for system evolution in the context of legal advocacy. So I guess I'll end by just saying that public health research matters, and its applied contexts can and need to amplify the work that you all do. And I hope we can work on the public health research to advocacy funnel, and that we can work together to actually figure out a way to operationalize the power of the research that's coming out of the public health space to actually force political actors to make the changes we know they need to be making. And I'll leave it there.